Ladies and gentlemen, welcome to the introduction to the research on the effects of Qigong massage on autism. Nowadays in China, many studies have been done showing the beneficial effect of Qigong exercises and Qigong massage on conditions such as heart disease, high blood pressure, and cancer. Although there has been research done on Qigong treatments on children in China, there's still very little published research in English. Qigong sensory training is among the first research-based Qigong intervention for children to be published in the West. The research done by Dr. Silva and the QSCI Institute is a combination of Western medicine and Chinese medicine on public health. The basis for the QST massage, as we know it today, came from an Italian doctor, Dr. Anita Signolini. Dr. Silva's main concern was in finding effective, non-invasive treatment for children with autism. She was especially interested in treatment with parent-delivered massage that can be given at home and through diet. Now, unlike Western medicine, Chinese medicine-based Qigong massage is given every day and usually for a year. It's a whole body treatment that has long-lasting effects on the main symptoms of autism as well as on the comorbid ones like the problems with sleep and digestion. Because it is given daily, it has a cumulative effect. It relaxes the child, stimulates growth and development, and is great for the parent-child bond. It also uses special techniques to improve sensory responses, especially to touch, and improvements in the sense of touch are followed by improvements in social development and learning. Initial results from two small studies with under 20 children evaluated the result for daily parent-delivered Qigong massage with weekly support from a doctor in Chinese medicine. The results showed improvement in language, social skills and behavior, as well in sleep and digestion at 10 and 20 weeks. These studies were published in the American Journal of Chinese Medicine. In Dr. Signolini's view, the massage had to be given by a Western physician who was also trained in Chinese medicine. At the time, there were only a handful of such doctors. So how were they to recruit them to treat autistic children? And even if they all jumped on board, they still wouldn't be enough doctors to meet the need. So Dr. De Silva decided they needed a group of trainers who had experience with autism and understood the emotional territory of autism well enough to make a good connection with parents. The early intervention people fitted the description perfectly and were desperate for effective tools. The next research was done with the university-based multidisciplinary research team working in collaboration with state-sponsored early intervention programs. Their first question was this one: what kind of research was required to convince school directors to include Qigong massage training into early intervention programs? Let's take a look at the state of the research at that time. That was in 2004. There were a lot of gaps in the research. The methodology was new and Qigong massage treatment was unknown. Apart from our small studies, there was no published scientific literature about Qigong massage for any medical condition, and larger studies were needed. This type of treatment was traditionally by Qigong-trained medical doctors. There were only two such professionals, one in Oregon and one in Sicily. There were no training programs for professionals or parents in Qigong massage. Our model for autism revolved around sensory and self-regulatory impairment. This was not a part of autism diagnosis in 2005, and therefore not considered relevant to autism. There were no outcome measures to measure the effects of Qigong massage treatment on sensory and self-regulatory impairment. And there was no rational explanation in Western terms for how Qigong massage worked. Over the next 10 years, all these gaps would be filled in. There was a need for larger studies, but no staff to deliver the service to families. So Dr. Silva felt the best people to train were people already working in early intervention programs. This meant developing an applied Chinese medicine curriculum to teach the massage to early intervention therapists. At the same time, she started developing parent training materials, a book with a DVD, and she created outcome measures for the comorbid symptoms to evaluate their response to treatment in the research. The therapist training for non-physicians in Qigong massage turned out to be a 5-month training and supervision program. The team tested the results of trained early intervention staff against results of a Chinese medicine doctor and found that both produced similar improvements. The paper was published in a mainstream research journal, the American Journal of Occupational Therapists. The curriculum was good to go. QSTI Institute began training early intervention staff in Oregon and eventually in other states and overseas. By 2012, Dr. Silva had a theory for autism that she needed to test. She came up with a model for autism that included the sensory and self-regulatory symptoms that she was observing in all the children. But remember that at that time, they were still not included in the diagnostic criteria for autism. And that showed them at the center of the model being primary cause of autism. So sensory and self-regulatory impairment were, in her view, the primary cause of autism, meaning that social delay, language delay, and abnormal behavior should reduce when treating the primary cause, regardless of the severity of autism. Now, once parent training materials and outcome measures were created, and a larger group of trained therapists were to practice in the research, and a model for the cause of autism was available, the team did a larger randomized control trial to the treatment. A volunteer sample of 46 children under 6 years with autism were randomly divided into treatment and control groups. They were all attending similar local early intervention programs, and evaluations were done by teachers who were blind to the treatment control group and by parents. Parents agreed not to begin new interventions unless medically necessary. The method was named QST dual intervention. These were 5 months of daily parent-delivered massage and weekly therapist-delivered Qigong massage. Here are the results of that larger randomized control trial. Sensory and self-regulatory problems decreased in the treatment group, but not in the control group. After 5 months of treatment, the treatment group had decreased autistic behavior and increased social language development. The control group had very little change. Mostly important, parenting stress was greatly reduced. These are individual pre and post results. All the parents whose stress was very high came down significantly. There was no change in parenting stress in the control group. The results were equally good for children highly impacted with autism and those less impacted with autism. Now note that I do not like to use the terms high functioning and low functioning, as low and high functioning only tells us something on how the world perceives the autistic person and is not telling us anything on how the autistic person experiences his or her life's challenges. Here are some video examples now. 4-year-old child with little language. He has tantrum, constipation, and sleep problems. First treatment, he refuses touch.
Just like on the doll.
4.5 weeks. First clear speech.
Nose, eyes, mouth, ears.
What a demonstration.
Very smart boy.
Martin, that's a first.
5 months later, exit interview.
Bus.
Door.
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 A door.
Door. He's having fun expressing himself, isn't he? You can see the pride in his face.
He's having fun repeating all the time. Everything that I say, he has to repeat it. I mean, some of the things he's missing it, but I'll make sure that he's going to repeat that. And he's saying it nicely, clearly. So I'm happy overall. Overall, he improves everywhere. In sensory, in speech, in behavior. I mean, I like it.
Now he's 4 years old and he's less impacted. This is the first visit.
Lay on the table.
Good job.
The first time we put Daniel on the table, he is afraid and holds his ears.
Yeah.
10 weeks later, he has a sense of humor.
Dr. Silver.
Yes. What, Daniel?
Hi, Daniel.
Hi, Daniel. You're supposed to say hi, Dr. Silva. I'm supposed to say hi,
Hi,
Daniel.
Dr. Silver.
Hi, Daniel.
Hi, Daniel.
No! Say hi, Dr. Silva.
Hi, Dr. Silver.
Hi,
5
Daniel.
months later, lots of social development.
Blanket to me.
You want the blanket, please? There you go.
I want pillow, please.
Pillow, please.
Pillow, please.
There you go.
Please.
You say
He
thank
goes
you.
from having to be distracted
You're
to just
welcome.
laying down
Are
and
you
enjoying it.
comfortable now?
Are you comfortable, Dan? Do you know what comfortable means?
The Resaerch.
This was what parents and non-physicians or therapists could accomplish together in a dual intervention. The paper was published in a mainstream journal, the American Journal of Occupational Therapy. Over the next 5 years, the team embarked on more controlled studies and continued to train the therapists and refine the training materials. They treated hundreds of children all over Oregon, published the results in mainstream journals, and presented the research at national and international conferences. They developed a Qigong massage program for children with Down syndrome and did a preliminary study with children with cerebral palsy.